I'm Jay.
I'm Adrian.
And together we are the
Two Crazy Cat Ladies.
I'm gonna cut you.
I think I just peed.
Buckle up.
We're back in the closet.
Welcome to another episode of Back in the Closet with the Two Crazy Cat Ladies. Guys, we are very excited because we are finishing up February, which is National Dental Health Awareness Month, pet aware thing. It's Dental Health Month. And we picked the best for last to bring to you guys on our podcast for this month. Dr. Katie Kangas, she is literally, we know a lot of vets now. We are blessed to know a lot of veterinarians. And Dr. Katie Kangas is like the be all end all in our eyes when it comes to dental health for our pets.
She is the reason we got to see a presentation. I know I always share this story, but briefly. We were at Thriving Pet when you gave this presentation about dental health. It was mainly about dogs, but so much of everything that you say is so applicable to humans as well. And it convinced me for the first time in 20 years to go deal with some of my own dental issues. So no better human to have with us tonight than Dr. Katie Kangas.
And it just makes my heart so happy that I got to do any kind of contribution to your health and well-being. And then your recognition or awareness of that helps you spread to more pet parents and pets, all from personal experience. And so what a beautiful story and a beautiful process that we got to be in together.
It's true. I think what's that word? Empathy is overused sometimes, but I have never experienced something so painful that has given me so much more motivation and empathy for our cats who suffer silently with dental issues.
That is such a good comment, Adrian. Such a good comment, because I could even lead into from that one of the important aspects of dental problems is that oftentimes it goes undetected by pet parents. And, a lot of board certified veterinary dentists say that one of the biggest issues is that dental problems are generally hidden problems. And that you've got all this, periodontal disease, either under the gum line that's not visible, but even if it is visible, people aren't able to look in their pets' mouths and pry around back there. It's not an easy thing to do. And, a lot of the veterinary dentists love to say, like, if that amount of infection or inflammation was spread out on an arm or a leg, people would be at their vet's office pronto. Like, oh my God, look at this. This crazy inflammation and sores and all that. That's got to be horribly painful. But it's hidden in the mouth and we don't know it's happening. Right. And pets generally will eat right through it. Sometimes people will see signs, but oftentimes they're undetectable, or the pet will just start to slow down in their activity level or their energy level. And, it gets presumed to just either be aging or gets undetected because it's kind of gradually happening. And so it is really, sort of appropriate that you do have this empathy and this awareness that sometimes these pets are silently suffering.
And it's true, the extraordinary amount of pain, and you couldn't, looking at me, you would never tell that there was anything wrong. And I think about, we've learned about dental issues with cats the hard way, the heartbreaking way. We've had lots of extractions in the past, and we've had cats that actually had a tooth rot out, a canine rot out that we found. And we
found in our bed, it was, we had no idea that they were even in pain. This was years and years ago. And it was like, how do we have a tooth of our cat in our
huge tooth
bed?
And you'd be surprised how often that happens, where teeth just come out or exfoliate out, we call fall out, because of the amount of infection under the gum line. And whether it's a true tooth, really it's an abscess, but a tooth root abscess, or at least chronic infection, inflammation, where the gums are receding and loosening up, and eventually the tooth can come out on its own. And when that happens, the level of disease is pretty significant.
And the level of disease, let's talk about this a little bit. I know we're going to be talking about some of your favorite supplements that are really, proactive and preventative and helpful for treating dental issues. But where'd it go?
Let's talk about it. I don't know.
talk about.
And before we get to the supplements, you were going to lead us into something. And if you don't, I will take it away and talk about stuff. Did you get your thought process back?
It'll come back to me. It'll come back to me, but please continue, because
Yeah.
it really is just about how our cats, I think, that we don't notice something. It is so gradual. And that's what I wanted to ask you. And we talked with Rita Hogan about this as well. Dr. Emily Stein, how health begins in the mouth. And so when we noticed, accelerated disease, finally, there are other things are being impacted.
Right.
Oh, for sure. And it's so cool, Adrian, that's where you were going, because that's what I was just going to come until you thought of where you were. I was like, I'm going to jump in and talk about how the mouth is a reflection of and is connected to everything else. And, interestingly, and I'll just relate this to, Chinese medicine, and it's not as much the teeth that come into that little, play, but in Chinese medicine, we are looking at the tongue as a true reflection of what's happening inside the body. And we're looking, is it dry? Is it moist? Is there pallor? Is it too deep red? Is it lavender? All of these things. Is it on the sides? Is it on the top? I mean, the tongue is like tongue diagnosis is like a whole subset of specialty, even within, traditional Chinese medicine or TCM. So that's a remarkable little thing. But also, we know now, and most pet parents know, but it's really good to have a reminder and a detailed description of the fact that our oral health and our pets' oral health is impacting our whole body health 24/7. And one of the ways I like to describe it is you cannot be in good whole body health if you are living with poor oral health.
Yeah.
And so many pets are. And the incidence level in pets is so high. Like dental disease is like the most common health problem, really. And,
I have to say, I heard you speak. I think it was actually with Dr. Emily and Lindsay on that live. I heard you say that exact thing, that you cannot be healthy if your mouth is not healthy. And we stole that idea and did a cat tip on it. I was like, that is brilliant. That is something that people need to know this month. Yeah.
I think that may have been part of the presentation that you gave at Thriving Pet, where it's like, you can do all the stuff and things to try to be healthier, but when you're ignoring a problem.
Yep. Because the inflammation and, an inflammatory process is the underlying process to everything chronic. These are all inflammatory processes in the body. And when you have chronic inflammation in the gums, it is just seeding inflammation, inflammatory mediators and, cells and all that to the rest of the body through the bloodstream from the gums. Also, any bad bacteria, any pathogenic bacterial load that's hanging around in here too is also going to the rest of the body through the systemic circulation. And that's why most people are aware of dental disease is linked to heart disease and can be linked to kidney disease. But honestly, it's linked to everything from arthritis to even IBD, because it's just inflammation that's being shared, and then inflammation that is just drawn out to, chronic phases, because it's still coming from here and, spreading everywhere.
That's remarkable. I don't think I've ever heard that it's related to arthritis, but I think it's interesting, and it's one of our big passion points. 90% of cats by the time that they're 7 years old will have some sort of dental disease, and 90% of cats by the time they're 8 to 10 years old will have arthritis. And that
and by the time they're 15 years old, they have kidney disease, right?
Yep.
Like you think about all of these things correlating together. And if we consider that it starts in the mouth, or that much of it could start in the mouth, right? There's dehydration, there's bad food, there's bad diets, there's all that contributes as well. We all know that. But if we think about how so much of it, you have so many people in our world, right, have been feeding a moisture-rich diet, sometimes a raw diet to their cats, and they still end up with kidney disease. And it's like, wait, you were doing all the right things, but were we looking at the mouth? Most of us don't.
And there's multiple, scenarios going on, but this is always an influence. It's always influencing the rest of the body. So it might not be the only influence, but it's a darn big one,
Right.
And the other thing that just came to mind as you were talking about older kitties with kidney disease is that diabetes, not as common as kidney disease, but more and more common.
Right.
And diabetes and periodontal disease have a very direct cyclical link together. Like diabetes drives periodontal disease and periodontal disease drives diabetes. So it's a disaster together. So literally, if a cat is diabetic or pre-diabetic, if you can ever catch them that way, cleaning up the mouth for humans too. You have better oral health, you have less likelihood of tipping into diabetes or being controlled better, or unfortunately for cats, a lot of them can convert back to non-diabetic, which doesn't happen as often in dogs and humans as it can in cats, which is a great feline miraculous skill that they have, that they can do that. But getting rid of periodontal disease is a huge ticket in helping that to potentially happen.
Wow.
I had no idea about
I
that.
didn't either.
Every time you open your mouth,
We learned so
we
much
learn
from
something.
you.
You guys are awesome. Thank you.
You are fantastic.
Likewise. You have so much to share, and I love being with you.
Oh my God. I wish we were back in there having some wine together. I know you have work.
It was so fun having you here and getting to be at Thriving Pet again together, and then getting to spend some personal fun time together. And I just cherish that. And it was just such a super fuel in my, last week of time. So thank you.
It was so good.
Same,
And with Dr. Barry as well. It was just cloud nine for us, for real.
It was.
I think it's remarkable though that there's, I don't think people do recognize just how much dental disease. I think that we all compartmentalize different issues.
Yep.
So I love that we've spent so much time focusing on dental health. We've learned so much this month just through these interviews. And I know that, like with Dr. Katie Woodley, we talked about the different things like the meaty bones and the other things that can be helpful. There's so many things that can be helpful. Let's talk about supplements.
Awesome.
Let's start off with a question from Karen. Is it ever too late to start supplements for dental health?
Never too late. I mean, honestly, it's never too late to start anything that is going to have a positive influence, and I mean, even, especially when it's natural, it's never too late. And, at any stage of the game, you are still going to be making positive impact. Now, that said, it's not going to necessarily take, if they're in more advanced, inflammation and disease states, it's not going to be the same as an anesthetic, cleaning, and, treatment and dentistry, procedure, of course, but it is absolutely not too late to start something to make a positive impact.
Yeah.
Love it. I love it.
Okay.
So let's dig in. You are such a brilliant brain. What are some of your favorite supplements for dental health?
Yeah, for your patients.
Okay, well, you mentioned teeth. We can start there because you mentioned Dr. Emily Stein, who we all adore, and she's just like such a brilliant mind, a microbiologist, and her creating the teeth formula for on the human side and on the pet side is truly such a godsend and so spectacular. It has been one of my, absolute favorite products because of the results that I see with it and the ease of use of it.
Yeah.
So,
Yeah, get those two together, and the fact that it's correcting the microbiome of the entire mouth. We're not just like, you have those like plaque off, you have those like certain things that are probably good, but it addresses one thing, right? And it doesn't necessarily address the entire mouth. And
yeah, exactly. And a really great way to describe that too is that what I love to tell people is that if you can brush your pet's teeth, obviously that's a gold standard of dental health and always will be. Brushing, mechanically removing as much plaque and biofilm as we can to get rid of some of that bacterial load, because it's the bacteria that causes the inflammation. So when there's bacteria hanging out in this plaque biofilm, then that is what the gingiva is, or the gums are responding to, going, hey, we don't like those bacteria. They're not friendly bacteria. And now I'm going to get inflamed and upset. And so then the gums get inflamed, and then the gums start bleeding, and then stuff gets shared to the rest of the body. But also you get those local inflammatory changes around the tooth root and, the gum area. And when we brush away that plaque and bacteria, then obviously we're lessening that load. So there's less inflammation and less, cycle of disease. But the thing is obviously there's obstacles to this. Some pets, it's a tall ask to even brush at all. And then, the best we can, if we can rub anything on their gums, and we'll talk about products, but that can be difficult. A lot of times just the time that to harness and the effort, I mean, compliance with, in the world today, and we're all so busy, the compliance with most pet parents, I mean, that's an obstacle too. But the other thing that, in comparison of teeth to toothbrushing, not that we don't want to attempt to toothbrush, it's amazing, but you can only get with a brush, you can only get above the gum line. And then if you're, using a soft bristle brush and you're getting to the gum line margin, the whole point is the bristles of the brush are supposed to spread out a little bit to just get a little bit under the gum line in that little subgingival space. But that's as far as you can get. And there is teeming amounts of bacteria, bad bacteria hidden way below the gum line. You can't get to those with a brush. So you get to what you can physically. But the beautiful thing about teeth is those ingredients, those prebiotic ingredients, are supporting the good guys above and below the gum line, and that unique prebiotic ingredient that is competing with the food source that the bad bacteria select for, so it's getting rid of them that way, that is also getting below the gum line. So one of the coolest things about that product is it is so far reaching in its capability, because it is getting below the gum line where you cannot get with a toothbrush.
Yes,
that's what's so exciting about it. And I have to give a shout out, I don't know if this is proprietary information, but with all the dental products that are out there, I was just slightly concerned, like how long until someone, it's like when someone starts a cool awesome pet food and then a big company comes and buys it, and then it's no longer a good. Right. And so I was just curious, but I didn't realize. Dr. Emily Stein has already had some offers, and she knows that they would just shelf it.
So
right, because it's that
has
good.
She shared that with you?
Not only cool beans, she is smart beans.
Right.
Yes.
Keeping something that's available for all of us, and that kind of quality product. And I do get what she does with one product could, be turned into many, many, many products. Anyway,
exactly.
I love
you mentioned you got your teeth in your drinking water, right?
Yes, I do right now. Yep.
Exactly.
Yep. This is
so, for pets, drinking water, it sloshes around the mouth, does the oral health, but then you swallow it, does some systemic benefits as well. And now, there's the lickable version too that feline specific coming out, right?
We do. We are working on something new with teeth, just so you guys all know. We are. I don't think we've announced it on our pod. She said it on other. Or did she say it was
She's
us?
got the dog formula. But we're working on something specifically.
We're working on something specifically for cats. And then she taught us. You were talking about the tongue, and that was something that was so interesting. And that we learned from Dr. Emily is that the microbiome of the tongue, the tongue has its own microbiome.
Oh, isn't that astonishing? I honestly didn't even, I think I've heard that, but it wasn't anything that was, even with all my oral health knowledge, was not really anything that was in my forefront focus at all. But I see an integrative dentist, and I have for years, done integrative dentistry for myself. And they always recommend doing the tongue scraper. And I'm like, oh, it's weird. I haven't really gotten that into my routine yet. And I'm really, I'm flossing and I'm brushing, but I haven't been doing the tongue scraping. But I know that, and even from the Ayurvedic, ancient, cultures, traditional cultures, that is a thing. And I oil pull and I do all these great things, but hadn't, gotten to the, the tongue topic. And then, who knew that a whole separate microbiome? And it makes sense. The skin has its microbiome and the mouth has its, and, every little, area of the region of the body has its own microbiome. But it's so astonishing that the tongue is even different from the rest of the oral cavity. But, it affects everything because the tongue, context everything else. And so starting there, as Dr. Emily Stein said, is a brilliant move. Who
Yeah.
knew?
I know, right? I
So you
mean,
call it
but
like a
probably
reservoir.
but
a
probably
reservoir
also
for
makes sense as to why in Chinese medicine they say like stick out your tongue. I want to see your tongue, right? Like our homeopathic doctor, when I'm like, okay, can we check? She's like, stick out your tongue, and I'm like, and she's like, you've been drinking.
Is there white caps? Is there, like there's so
But
many.
they're not looking at your teeth; they're looking at your tongue.
Mhm.
So so it makes sense, but it's very interesting.
Okay, so teeth is awesome. We're very excited about teeth.
You also have
You have an awesome product. Let's talk about.
Oh, thank you. Yes. So from my line of products at Share Your Bowl, and the reason why my product line company is Share Your Bowl is because the whole premise was starting products, creating products that are geared for pet health, inspired for pet health, but all of these make sense to use for ourselves too. And so that's the great thing. So for dogs, cats, humans, we can share so many of the same, positive, impacts with these types of products. And so I have just a little demo of my dental. I don't know if that shows up, but my dental remedy. And this is, everything's organic. Organic MCT coconut oil is the base. And even just using that alone, obviously, I'm sure you've talked about this plenty of times, but even that alone rubbing on the gums is already so beneficial. So even if that's all people do for gum care, that is total bonus. But then in addition to that, I have organic essential oils of peppermint and myrrh. And peppermint is breath freshening, but is also antimicrobial naturally. And myrrh and frankincense, a lot of people talk about those at the same time because they have a lot of similar properties. Very powerful oils, medicinal oils. And myrrh is phenomenal for gum health and gingival health. It's very effective at keeping inflammation down in the gums. It's also known to help prevent or address, shrink oral tumors or growths. So that, and we actually we got to get this testimonial on our website. We have one of our clients recently just said that there was a little oral mass coming up in her pet's mouth and she was rubbing it on there daily. And within like a couple of weeks, it was gone. And she was like, oh my God, this is amazing. So that was really cool. And then the final ingredient in here is trace minerals. So a lot of people are aware, like the sea dent and the, seaweed. Minerals are so helpful also in keeping healthier saliva to protect the teeth and healthier, enamel and strength of teeth. So helping to keep the teeth mineralized and strong.
Yeah, Rita Hogan last week talked
that.
about trace minerals. It was actually the first time we'd heard of this, right?
Oh,
Go. This week on our podcast while we were in San Diego in our hotel room, she spoke about the trace minerals and how important these minerals are.
No idea.
Yeah.
I want to circle back to one of the ingredients in your awesome product. And your product, it just says the dental on it, right?
Yes.
If people are on your shop looking for this, one of the ingredients is the MCT organic coconut oil.
Yes.
And I feel like that's something that a lot of us are familiar with. I think even Dr. Judy Morgan has that in like her.
She has a recipe for toothpaste with Cocoa Therapies coconut oil.
Yes.
Is that the MCT? They have the best of the best in the world. The best.
Oh. So that's what we're using. And
my question is so a lot of people already are familiar with organic coconut oil. What is MCT coconut oil? What is the difference, or how do you?
Yeah, that's actually a really good question. So MCT, medium chain triglyceride, is like a component. That's like the component of the fatty acids that are in coconut oil. So it's like a fraction of that. So they're interchangeable for a lot of health value, anti-inflammatory value, that kind of thing. Even in cooking and baking and that sort of thing, what a lot of nutritionists, nutrition buffs will tell you is that you can use either coconut oil or MCT oil. If you're not a fan of coconut flavor, use MCT. But they're both very enriched, obviously, with these medium chain triglycerides, fats, which have a slew of health properties, and certainly anti-inflammatory. I mean, clearly, fitting a keto diet, being a healthy fat, all that kind of thing. And even having some antimicrobial, properties as well.
I love that. I've always wondered, and I never know exactly how to say it. And the Cocoa Girls are so brilliant, and they've explained it to me before, but I can never get it out right. So,
well, we always tell. So prior to learning about teeth, everybody would be like, okay, well, what do I do? And we're like, brush your cat's teeth. Like, teach them, start slowly. Ryer Cat. I don't know if you're familiar with them.
Oh,
you should be, but they make a cat specific toothbrush. See, I got that.
Sorry.
I got the thumbs up on that one.
But
they make a cat specific toothbrush. They're out of Canada. Just like beautiful people, beautiful product. Like it is. She was a dental hygienist. I don't know. Or yeah. And she realized when her cat got dental disease, she realized that she needed to brush their teeth. And then but there was no toothbrush, like you usually get the baby toothbrush, like they'll just give you or your finger thing, which, all of it's okay if it works. Right. But they made a toothbrush that is specific so that it doesn't rub up against any other
ergonomically correct.
Right.
For a cat's mouth.
For cats. And
I need to see that. I need to go look that up.
I'll send you a link. They're beautiful, but people would be like, but what do I use as far as a toothpaste? And we always said, put coconut oil on it.
It's perfect. It's perfect because it's not offensive to it. I mean, a lot of cats like it. They will lick it up. Yeah. And, you want to make the toothbrushing experience as pleasant as possible so that, you're more successful in actually getting it done on a routine basis. And coconut oil is so beautiful because it's easy and, it's palatable and it's useful. So win-win-win.
That's what makes your product really awesome. The frankincense, the
myrrh, the myrrh and the peppermint. And the thing is, they're very subtle. It is not overpowering. So, I really worked with the ratio to, and did it all myself. I oil pull with this every morning. And I could do it. And I've been doing, that for a long time and oil pulling with, and I took like Ayurvedic health courses, years ago and all that kind of stuff. And then tradition came from there. And a lot of oral health experts obviously recommend to swish MCT or coconut oil around in your mouth for 10, 15 minutes, daily. I do it every morning. But years ago, I started adding essential oils because I know the value of, that for inflammation and oral health. And so started playing around with, what would be a good ratio to do for pets that would be medicinal, but still taste good and not taste too strong. And it's subtle, but it tastes good. And when people try it, they're like, I like this.
Awesome. Yes. I love it when you can make products that are so helpful for pets that are human grade that they can try themselves, taste and all that. But the trace minerals, man, that's the little cherry on top as far as just the newest thing that we've been learning about.
Yeah.
I've still got it taking
it's kind of more, recent, current, cutting edge that people are starting to realize the importance of what that does for oral health and dental health.
Yeah. Wow. Okay.
I love it.
So let's talk about other supplements. So you had said we watched you held a dental course, like was it last month or December?
Like a little workshop. Yep.
Yes, a workshop that we joined, and we were so excited to learn from you. We were like, okay, we get to learn more, and we do. Every single time you speak, we learn more, and that's why we love you so much, or one of the reasons why we love you so much. But you had said one of your favorite recommendations or one of your favorite supplements was krill oil. And we had never heard that. We are big fans of krill oil, huge fans. Like we're working on something for the cat community just dropping it out there. But we did not know that until we heard you say this, we did not know that it had an effect in dental health. So how does that?
Yeah, omega-3s. And krill oil is a phenomenal form of omega-3. But omega-3s are incredibly beneficial for inflammation, period. So, so omega-3s, just to clarify this, a lot of people probably know, but the omega-3 fatty acids that we're referring to is DHA and EPA. And these are long chain fatty acids as opposed to the medium chain fatty acids, MCTs. These are long chain fatty acids, but DHA and EPA are what our bodies use efficiently as omega-3s. Okay. And so you could do, fish oil sources. I generally like to steer people toward sardine anchovy blends as opposed to the common salmon oil and stuff, because they're generally, cleaner, less contaminated. But sourcing matters, quality matters, refrigeration matters. Krill oil is awesome because it is more stable. It's much more stable. It doesn't oxidize easily like the fish oils. And it tends to be a really nice match for cats. Also, for some pets that might have a fish intolerance or fish allergy, krill is a nice, bet for that. Some people turn towards the algae oils, if they think their pet is, fish sensitive, etc. But bottom line is, omega-3s are great for inflammation. And most people are aware of the fact that they're good for joints, they're good for skin, they're good for the heart, they're good for the brain, they're good for the kidneys. And lo and behold, they are phenomenal for oral health too. And there are actually many studies in humans and animals that show that omega-3s are helpful for periodontal health. And they can be helpful either rubbed on the gums, like we just talked about with the MCT oil, and they're also helpful when they're ingested. So either way, they are supporting anti-inflammatory mechanisms in the body and directly in the gums and the periodontal tissues.
It really is mind-blowing. When you said that during your course, I went looking because you hear about the brain, the heart, the organs, the
skin, the
coat, right?
Yep.
For sure. But you never hear that it's good for the mouth. And I guess, you could kind of infer that it's, anti-inflammatory properties would be helpful, but there are some
to know that it is well proven. And there's actually human studies I cited in my talk that showed the inverse, relationship of, when people are on, routine omega-3 intake via supplement or diet, that they, inversely relates to the correlation of periodontal disease. People that take more omega-3s by and large have less periodontal disease, and people that take less have more periodontal disease. So, but, and they've been able to show the changes when you use it, what's happening with the gums. So.
Wow.
I think that Jay and I have made more decisions to better our health every time we learn something that helps our cat.
Isn't it? I'm telling you that that is one of the most rewarding things for me personally, of being a holistic integrative veterinarian. Is it just makes my heart smile and sing every time. And I get told often, so I'm so fortunate. Every time somebody tells me that they themselves or other human family members have gotten healthier along with their pets because of things that I share with them. And like, what could be better,
Right, exactly. Right.
Yeah.
Like, because as a family, we're changing, right? As a family, we're all getting better. Energetically means a whole lot.
It means so much, because we know that, our pets are reflections of us, and we're also bonded. And so the healthier we are, the healthier they are, the healthier they are, the happier we are, the happier we are, the healthier we are. And it's like one big, awesome,
happy family.
True, though. It really is. And the old adage of like, you can't give what you don't have. And it's like, for many years, it's like, we'll do this for our cats, but we're going to eat crap, or when you recognize that it's, holistic health for our cats is holistic health for all of us. Like,
right.
WH.
Amen. Yep.
It is a big deal.
Household wide, goodness. So I love it.
So, Dr. Kangas, tell us a few more or any more supplements that you like, or other tips even that you have for the cat community when it comes to oral health and how to keep it, make it, fix it, all of that.
Awesome. Have you guys talked about the 1TDC? Do you use that?
No, but I wanted to ask you about that.
We used it though.
Okay. So yeah, so the 1-TDC is a unique product, and it's actually an esterified fatty acid. So it is a fatty acid, but it is not an omega-3. It is not an MCT. So it's very different. You know, the chain, molecular chain, whatever. But 1-TDC is actually an acronym for one tetradecanol complex. So nobody wants to say that. So 1-TDC. And it is in, as I'm sure you know, it's in a little gel cap that is heart shaped that you twist off, and then this little sticky, thick gel comes out. And there is some beef tallow in it. It generally, some cats like it. Most dogs love it. You probably know more about palatability with cats than I do, but some cats will definitely lick it, on their own. Or you can just rub it on your finger and rub it on. You can, squeeze it from the capsule, or you can put it on your finger and then rub it on the gums. But the ingredient in that, the 1-TDC, is exceptionally helpful at bringing inflammation down. It's anti-inflammatory in a different mechanism, a different, pathway of doing that. And it has a high efficacy and affinity for two types of tissues in the body, interestingly. And one is the gingival tissues and the gums and periodontal tissues, and the other is the joints. And so the product, it's funny, when the product first came out, there was actually two different bottles. There was a joint bottle and an oral health bottle, periodontal bottle, and it was the same exact product. So they got smart and they just put periodontal health and joint health because it does both. And so, some people use it for the mouth, and then they're like, oh my God, my animal's moving better. And then I've had people use it for the joints, and they're like, oh, I can tell the oral health is better. So it is really cool. And even if, if it doesn't contact the gums, it still benefits, from systemic, absorption of it. But if it's put directly on the gums, you are going to get more impact for the oral health. If they just swallow it down, like if it's a dog that's swallowing the whole capsule or whatever, then it will help the joints a lot. But, if we get it in the mouth, then it's going to really help those oral tissues. So have you guys used it before? Do you have any feedback on it?
I used to use it for Pooh Bear, and it was for joint health. But also, but I would put it on he was not one that you could touch his mouth at all.
Okay, there you go. Yep.
So I would just put it on top of his food. He had no problem eating it, and it was it was definitely helpful.
It's a unique product. It's a natural product, so it's a really good proactive, preventative. But even if obviously there's inflammation there, it's just a great thing to do. And so, I love having multiple tools in the toolbox because generally I love telling my clients this too. A small collection of things. I mean, we don't need to go gonzo. We don't want to be doing 30 supplements, every day for, our pets or ourselves. So, coming up with a small handful of sensible things that we, use together comprehensively gives us a better outcome than just wanting one thing to do, the whole job. And so it's lovely that if the pet will eat the 1-TDC, that's just one more option that can make a total impact. Added to other things or not.
We've got Sissy and Jessica here. They just dropped the links for Jessica dropped the link for your dental product and the 1-TDC, and Sissy also dropped both of those links here.
Yay!
And I also think it's really awesome because like Rita Hogan always says, every pet is an individual. I feel like we can see incredible results with one product, and we have another cat that won't touch it, right? So. Exactly. I really encourage everybody, when you're looking at, like you said, don't go gonzo, don't go buy the whole shelf of stuff. But when you're looking at what it is that's going to work best for your individual cat, go read the reviews. I think that's such an insightful thing to do, because you're going to pick up on the people who are like, my cat is super picky, or my cat doesn't allow this, or just look to see what's going to be best and then start there. Like Dr. Katie Woodley always says, don't be overwhelmed. We talked about a lot of really awesome supplements tonight. Don't go get them all. Just start with one thing.
And
then you said that. I really, really, every single time I have a session, an appointment with, my clients, pet parents, I always say, part of my value to you is to, help you from feeling overwhelmed too, because I'm mentioning so many things. So I always, caveat that with, these are options, And I always put them in what I think is a good priority order when I meet with people. But it's just nice for people blanketly to know that when we're discussing a lot of things, we're not, suggesting that you do all of these things, and certainly that you're not starting them all at the same time, but that you can just, with your judgment, slowly implement things that work for your pet, that your pet accepts, and, putting a little regimen together that works for them.
Yeah. And dental health is one of those things where it's like, if there's one place you can start, especially proactive care, this is such a, like you said at the top.
Yep.
Oral health impacts all of health.
Everything. Yep. And then the other thing I can say too is that anything that's antioxidants, so in my talk, I talk about a Clearly diet, and, we'll just segue to that for a moment, because I'm sure you've talked about that with your other, podcasts this month, all about dental. But clearly a heavily processed food that's adding more carbs and sugars and, inflammatory mediators and all that is, doing a deficit for oral health. And fresh food diets and, low processed foods and all of that are much more largely supporting a healthy mouth and a healthy body. But other specific ingredients in the foods or in supplements, such as antioxidants, are such a great thing for oral health as well. And so is it from your line, the OxyCat would be something that is a really good choice for many things, but also can apply to a healthy mouth.
Yeah, absolutely. So OxyCat is an antibacterial, antifungal, antiviral, alkaline-based remedy. It's been used for like hundreds of years for a lot of different things, but specifically for oral health, we have been using, we probably use it more on ourselves than we even do our cats. But whenever there's, we rinse with it, we swish with it. If there's like like last week I had this, I think it was just a cut in my gums, but I thought it hurt every time I brushed my teeth. And I was like, I think I'm getting some kind of inflammation or something going on. I swished with that. I was like, okay, let's kill this. It's anti-inflammatory. Process. Yeah. So it definitely helps the healing process there for sure.
That is awesome. That is awesome. So that, and probably even your VitaCat, because there are antioxidants in that too.
Yep. So and our catalyst has I didn't even know, like when you said
superoxide dismutase in it. So
the superoxide dismutase in the catalyst, which is product, is antioxidant enzyme that we absolutely love.
Yeah. Okay, that's probably the one that I was thinking of, but I know the OxyCat is so useful too, and so it's great to bring that into this aspect of its antimicrobial benefits. So such a good choice for the mouth as well. So
to bring it back to the food though, so I think we've asked everyone this month that we've interviewed on our podcast, and I know it's a little funny. So you don't believe that kibble cleans teeth?
Absolutely not. Absolutely not. So yeah, you guys must have, hit that one plenty of times.
But it's remarkable.
Sometimes you have to. Like, we literally still have
many people that say my vet wants
all
my cat
the time
kibble for their dental health.
Yeah.
Literally for their dental health.
I can't, my vet said don't feed wet food because it'll make my cat have bad or cavities, right?
Your cats get cavities.
It's like,
and so people are still giving you that feedback currently.
Yes.
Right.
So it is a shame that veterinarians are still under that impression, because it's false.
Yeah. I mean, it's a myth that's been busted for a long time, but it's still,
but it still perpetuates, like a lot of myths. It's just, hard to let them go. Yeah. Yeah. Something that's, cited as truth enough times, it's hard to get that scratched off the truth column.
But there's nothing like having the one and only Dr. Katie Kangas friends here today telling you, no, kibble does not clean your cat's teeth.
Oh, and in fact, yeah. So it doesn't, and what I like to tell people, I mean, very, scientifically or medically, it's not that scientific, but I mean, they've done studies to show that when they're eating dry food, if it cracks, it's negligible, but if it cracks tartar off the teeth at all, it's on the points of the teeth, and what's affecting the health of the animal or the human is where the tooth meets the gum line.
Right.
And kibble's not rubbing up on that. They're not, that's where you're getting into the raw meaty bones and the things that they would chew on. And in the wild, when they have to sit there and, really, chew a prey item or something that they have, but kibble, I mean, most pets don't, certainly dogs and even cats too, don't often even chew the kibble.
Right.
And if they are, it's not rubbing on the gum line. And then meanwhile, kibble has, oftentimes a large amount of starch in it, which is, right there driving more inflammation and feeding more bacteria. But also with the processing and the ingredients and all of that, it's just causing inflammation and it's causing more bacterial load. So kibble's like a negative for the teeth. It's not only not helping, it's like harming.
Correct. Yeah. And you look at like the statistics of the amount of cats that are getting dental disease, and then you look at the statistics of the amount of cats that are fed dry food, and you're like, if kibble actually clean teeth,
right, then why would so many pets have dental disease? That's actually brilliant.
Right. It doesn't add up.
Doesn't add up. Yeah.
Right.
The common sense of it is.
Got it. So
yeah,
there's proof in the pudding right there.
It's true. And it's really remarkable when you watch cats like really gnaw on something. I know after we talked with Dr. Katie Woodley, she was talking about the raw meaty bones and that sort of thing. And I admit, like I'm easily grossed out.
She won't do it. She'll be like, you can do that, but stay away from me.
We did order their duck necks. And I am trying to get up the courage. Maybe you can encourage me to bring out the duck necks and get some good videos. When cats really start gnawing on something, contrary to what you just described with kibble, where it might crack on the tip of their tooth, they are deep in on those.
They are all getting in there, and they got to angle, and they got to move their jaw, and it's this true, evolutionary way that they were supposed to do that. And it's so different from eating little kibble. I mean, 100% different.
Oh, 1,000% different. Yeah. It's the way that they were meant to eat.
Okay. We're going to do it at some point for sure.
So are there any final thoughts or supplements or
top of mind that we missed?
Yeah,
I would say, anything for immune system, so from mushroom products and other, nutritional, I love functional medicine. So, even Standard Process has the Biodent formula for dogs and for cats, which is a little food-based tablet that has, spleen, and it's got other organ meats and things. It also has manganese, which is also known to be a good thing for ligaments. It helps the periodontal ligament be stronger, in the, tooth root socket. I mean, there's some cool ingredients in there, stuff for immune system as well. So anything you can do for immune, because again, cats get, which we didn't actually go into, and you've probably gone into this discussion in some of your previous podcasts this month, but the resorptive lesions that cats get, that are thought to be immune related. And then kitties get stomatitis too. And so there's a lot of sort of feline specific oral diseases that, anything we can do to support their immune system, as well as all the stuff we talked about, keep the microbial load down, keep the inflammation down, but immune support is fabulous. And mushrooms, which I know you carry some liquid mushroom extracts that are so wonderful and effective and palatable. So such a great choice for cats. And then the Biodent is a nutritional, an option that would support some of those same things, but also not only the immune, but the structural support in the periodontal, tissues. So
say it again for those of us in the back. That's Standard Process. Biodent.
Biodent. Yep. And there's actually a human version, by the by. And then there's also a veterinary version. So it's the same. It's just in a different bottle. But they do sell it for, they do label it for dogs and cats. So.
Wow. Oh, that's awesome.
I had never heard of that.
Food medicine and glandulars, like you may know, a lot of the feline Standard Process products, a lot of cats don't mind the flavor or even like the flavor and will eat it like a treat. Right. So Biodent's going to be similar, where, there's organ meats and glandular extracts in there. So, as far as supplements go, it's generally a pretty doable one to get into kitties.
I love that.
So if they have a propensity for, like I said, there's so many different supplements you can do, but where I would, really lean into the biodent is if you had a, kitty or even a dog, if we have a pet that has a proneness to dental disease, have they already had, resorptive lesions? Have they already had tooth extractions? Are they genetically, are they a cat with, a brachycephalic with the pushed in face where they're, got the crowded teeth and they're more likely to have problems?
Right.
In the dog world, are they the little breed dogs that end up with dental, horrific dental disease by the time they're 5 years old, like the poster child of dental disease Yorkies, and I always tell people, like, that's the classic kiddo to put on, biodent. And, kitties, whenever it fits sort of that picture where you've had some dental disease issues already, or we just are in, the category of maybe higher at risk for those sorts of things, then that's a really nice thing to think about. But all of the products we mentioned are, so that's great too.
Oh my God. I just want to do a quick review for everyone that is maybe just tuning, and you can go back and listen to the podcast. But today we talked about Teeth, great product made by Dr. Emily Stein. We have the daily dental care for dogs and cats made by the incredible Dr. Katie Kangas here with us this evening. And go check out the ingredients, go check out the reviews. We talked about krill oil, omega-3s, the power of omega-3s. We talked about
Coconut oil.
We talked
MCT oil.
about
1-TDC.
One TDC, that's what it is. I always think of breakthrough T1D. I always think of a totally different thing. Totally different.
My sister's a type 1 diabetic,
so I'm easily confused. And then this product that Sissy actually just dropped the link here on YouTube and Facebook for Standard Process Biodent. So exciting, you guys, to really be able to go start checking these out, see what might be a good place to start for your individual cat, and just get in front of it. And if you're already dealing with dental issues, like Dr. Katie Kangas said, it's never too late to start. Deal with the acute issue. Go get the cleaning, go get whatever needs to be done to clean that up, and then get proactive about it.
Yep.
Perfect. Well said.
Dr. Katie Kangas, thank you so much. I love you so much, especially since you have more patients and more work to do tonight, and you took this time to be with us this evening. You're a rock star and a baller, and we're just so grateful for you.
Thank you. I love you both so much too. Thank you, Adrian. Thank you, Jay. It's been a pleasure as always. I can't wait to see you again soon.
Very soon.
Yes, we will see all of you guys again very soon.
Love you guys.
All right. Bye, guys.
Bye, Dr. Katie.